I'm currently talking about constipation. Constipation is a common condition among middle-aged and elderly women. Having one bowel movement a day is the normal physiological rule for a healthy person. If you can't ensure regular daily bowel movements, an excess of toxins can be absorbed into the body, leading to an unhealthy complexion, poor mental state, unstable emotions, and even depression. Therefore, it is essential to take constipation seriously. Constipation can be divided into two parts. The first part is difficulty in passing stool, meaning the stool is dry and hard. The second part is the inability to have a daily bowel movement, such as every 2 days, 3 days, 4 days, or even once every 2 weeks. These are all significant manifestations of constipation. Many people are not aware of the reasons and may blindly take medication or eat more vegetables and fruits, which may not be effective. In fact, constipation is not caused by changes in the quantity or quality of food. It's like the whole family eating the same meal, and everyone else has normal bowel movements, but you have constipation. This is because your pelvic floor was damaged during childbirth, and there is a strain in the posterior pelvic floor triangle. The anal sphincter and nearby muscles are injured, leading to an emptiness in front of the rectum. The volume of stool increases, and you only feel the urge to defecate when it reaches a certain point. In this process, excess moisture is absorbed from the stool, making it dry and hard. At Antai Hospital, we reinforce the anterior wall of the rectum through laparoscopy. After reinforcement, the rectum returns to its state before childbirth, and constipation is no longer an issue. We can ensure regular daily bowel movements, which not only maintains normal physiological function but also helps maintain a harmonious family relationship and a good mood. The original cost of this surgery was 50,000 renminbi, but recently, there is a promotion at 30,000 renminbi. Some patients may ask, what if I still have constipation after the surgery? In that case, we recommend choosing a treatment contract. Before the surgery, you must sign an agreement to ensure normal bowel movements after the procedure, ideally daily, or at the very least every other day. Otherwise, a refund can be requested. This is the commitment of Antai Hospital and the contribution and innovation of Antai Hospital's anterior rectal wall repair procedure.